We are Holisticare and we are working to provide better care solutions at the Neurointensive department at Reese Hospital. The department is moving to new modern facilities. This means changing from open wards to single rooms. Single rooms have been proven to aid with faster recovery, however it is estimated the number of patients which can be cared for will be halved. Currently, nurses can provide effective care for 14 patients. The open layout allows multiple nurses to observe multiple patients at one time. This open layout is also conducive to personal and professional conversation. Nurses are within a 3-metre proximity of the patient and always have a constant visual from their control room. This layout still allows for 14 patients to be cared for, even when nurses have to leave the ward to prepare medicine or take breaks. In the new layout, patients are located in single rooms along a corridor. The walls are physical barriers to observing patients. Problems arise when nurses need to prepare medicine and take breaks. This would leave patients unattended and pose a potential health risk. The department proposes it would only be able to care for 7 patients, leaving a deficit from the previous state. Furthermore, their working conditions will be seriously diminished. When nurses are isolated in a room for the entirety of their shift, communication and interaction becomes both difficult and infrequent. It is surmised that the staff will resign as a consequence. This will result in a spiralling cause and effect of decreasing nurses and then patients. The solution is twofold. Firstly, the workflow is organised by placing the nurses into small groups which are responsible for certain groups of patients. Secondly, the nurses will be given a device which allows them to both receive alarms from medical equipment and other nurses, whilst being able to alert when they require assistance. The device will be part of a larger system which tracks the nurse's location through RFID technology, thus allowing the system to automatically alert the most appropriate nurse able to react. The device allows nurses to be organised into more flexible workflows. Nurses can perform other tasks such as preparing medication and reacting to cardiac arrests, whilst having the confidence to leave a patient, safe in the knowledge they will be alerted if there is something wrong. Consequently, the patient to nurse ratio is increased, allowing the number of patients able to be cared for in a new facility to rise from 7 to 10.